My name is Sherilyn Wilburn. I am a women's health nurse practitioner. Throughout their life, women are concerned about many different things. Early in their life, it's often birth control, pregnancy, contraception, and infections. As they get older in their 30s, it may be continuing with pregnancy issues or concerns, birth control. As they move into their 40s, they often start thinking about menopause and changes with their cycles. In their 50s, they're definitely concerned about menopause and issues that go along with menopause. Then as they, through their 60s and on, they're often concerned more about general health concerns such as high blood pressure, diabetes, as well as continuing to manage menopausal symptoms. Women often start menopause in their 40s. Some women may start as early as their late 30s in terms of symptoms of menopause. Then in their 50s, as they stop having a period, which that's the definition of menopause, is no period for a year, they will start having those symptoms. Some of the symptoms, the most common ones that women talk about, are hot flashes or night sweats, inability to sleep. They may have mood swings. All of those things can be symptoms of beginning the process of menopause. Some less well-known ones are joint pain, which automatically many women associate with arthritis, but that can be associated with menopause. There may be brain fog, which some women don't associate with menopause. So anything that is changing from what you've been before to what you're experiencing now may or may not be a symptom of menopause. There's various treatments that many women aren't aware of. We have hormonal options that come as tablets or oral pills. There's creams, there's patches, there's even gels and sprays that can be used in terms of managing hormonal symptoms. And then there's also now a variety of non-hormonal medications that can be used. In terms of when to start talking with your provider about them, whenever you start noticing symptoms, or even before that, if you're anticipating, coming up, you're 42, 43, and you know that those symptoms might be beginning soon, then bring them up with your provider at your well woman exam. Screening tests throughout menopause or at the beginning of menopause, pap smears, of course, are important. Mammograms become important as you progress and begin menopause, as we know that the risk of breast cancer increases as we age. Making sure you're up to date on your colonoscopies, which generally we recommend starting around age 45. And then as you progress through menopause and get older, a bone density scan to examine for osteoporosis, which occurs as we get older into menopause. It is important to remember that lifestyle throughout life does affect later on. So making sure even as younger women that you are, exercising, monitoring your eating habits, getting good sleep. All those as a younger woman will also carry over as good habits as you go through menopause, but also are important in terms of staying healthy throughout your life. I am taking new patients, and you can call the office. MUSC Women's Health Lugoff is where I'm located, and look forward to seeing you.